I'm Julia Hutton, a nurse practitioner with the Center for Family Medicine. So for nurse practitioners specifically, AI Scribe I think is really going to help shorten the amount of time that we need to spend with patients. Our appointment times are 30 minutes, and so with AI Scribe, part of that 30 minutes is having to do all of the charting as well. So if we didn't have to do that part of it, if AI Scribe was doing that for us, then we could generally reduce our appointment times, I would assume, by at least 10 minutes and have 20-minute appointment times instead of 30. Throughout the day, if I'm seeing 16 patients in a day, saving 10 minutes for every one of those 16 patients opens up a whole bunch of extra appointment times for things like same day or next day appointments for patients, so they have better access to care. So if I incorporate AI Scribe into my practice, I can really see it shortening my appointment times, so I'm able to see more patients in a day and have better access to care for patients. Using AI Scribe in my practice, I'll be able to actually focus on the patient, make better eye contact, which in the end makes better therapeutic relationships with our patients.
My name is Naik. I'm a family physician in Waterloo and a healthcare innovator. So when we look at AI Scribe, we get excited about technology. We love the words artificial intelligence. But the important part here is actually, what about the humans that work with it? What are the humans that work behind it? And the biggest part that your team has provided is that change management aspect of what is that operational flow that comes through my office? What are the technological considerations we need to make? How do we start implementing it so we have the minimal amount of disruption and we get the maximum amount of teachings from all the experience that your team has so that we can implement faster and better so we can provide better patient care. When we're looking at the implementation of AI Scribe, your team has provided a round service offering. When we look at it from the initiation, the understanding, getting from the buzz of what artificial intelligence is to understanding what the risks are, knowing where we can use it and where should we not use it, and analyzing what is my practice flow, looking at the types of appointments we have, seeing which appointments would be best utilized for artificial intelligence, which appointments are best utilized for the change management tools that already exist from previous change management solutions provided by your team. When we move on from there, then we look at how do we even do the simple things of logging in? What is the amount of screen size we need? What's the hardware that we need in our office? Finally, those run-throughs of, okay, you have a patient that comes in, they're seated there, what is the consent process? What do we need to ask them before we can even initiate that, the artificial intelligence? How can we bring the patient along with the journey, showing them what that AI can do? And then finally, the importance of proofreading, looking at the AI Scribe, and then finally implementation into our EMR. Part of that journey has been, well, what's the benefit realization here? The AI Scribe takes time. It takes time for me to get used to it. It takes time for my team to get used to it. It takes time for the patients to get used to it. And over time, that trust is built. When we build that trust, we can actually start doing more and more with technology, implementing it into our office, bringing on complementary bots, bringing in complementary AIs, so that in the future, we're burning out less and we're providing better care.